I am, and then we can get started. Hello, everyone that's joining. Just waiting for Theo, and we will get started. So, as I wait for Theo, I'll give everyone a few minutes to join. Um, Hi, everyone. Just trying to figure everything out. There's Theo. Hi, Theo.
Hey, how's it going?
Okay, my apologies for not being great with Instagram.
No worries.
So just to introduce everyone a little bit, this is our second installment of the Alumni Speaker Series. Last month we had Manny join us, and every month we'll be trying to have a different alumni join us and kind of answer any questions and hopefully give some advice for current students. So this week I'm joined by Theo, who is currently completing his residency at San Diego, right?
Yes, yeah, UC San Diego. Yep.
Okay. So I guess we'll follow your story to where you are now, but maybe you can start us off a little bit, telling us a bit about yourself, where you grew up, where you joined SRLA. Yeah, where does your story start out?
Yeah, awesome. Well, first of all, Katja, thanks for having me. I know Katja and I first met in SRLA in sixth grade. So it's been a while since we last spoke, but I appreciate you for having me
Yeah.
on. But yeah, so I'm Theo Roper. I grew up in Los Angeles. For those who care, I grew up on like Slauson between La Brea and Crenshaw, just to give you a area reference. Went to elementary school at Hancock Park. Middle school was John Burroughs. And then I went to high school at University High School over in West LA. I went to college at UC Berkeley, which I can also answer questions about how I got there.
Yeah, so I'm actually sorry. Like Theo said, we haven't talked in a long time. So I'm personally curious, how did you decide on UC Berkeley? So I actually didn't know you went to Hancock Park Elementary School, which is funny because I went there as well.
Mhm.
But yes, we met at John Burroughs Middle School, and then our paths kind of left each other because you went to University High and I went to Hamilton High.
Right.
But then from University High, yeah, how did you end up at UC Berkeley? I don't think that was extremely common from University High School to go on to a UC, let alone like UC Berkeley. So what was your path that led you to
Yeah,
Berkeley?
yeah. So I don't know if I can shout out other organizations, but similar to my
Sure, sure.
no, but yeah, similar to my experience with SRLA, where um, you know, I didn't really. I guess I kind of fell into the opportunity. I know Miss Cook was our coach slash leader at John Burroughs, and um, I was like able to talk with her, and she's kind of who got me to join the group in the first place. And in a similar mantra to SRLA, who they reach, based in LA and inner city middle school, high school students. I think they use the term kind of sometimes at risk. I was given the opportunity through my high school counselor to be part of the Posse Foundation, and the Posse is kind of a similar entity where it's a scholarship group where they actually take 10 students from the inner city LAUSD system, and it's usually people of color or minority backgrounds or first in their families to go to college. And I was able to be a part of that cohort. So there was 10 of us from different high schools throughout LA who got the opportunity to kind of go through the interview process, and then we were selected to get scholarships that helped us to be able to pay to go to Berkeley.
Oh, cool. So 10 students from the whole LAUSD system. I never heard of this
Yeah.
organization.
And so there's other
That's
colleges. Berkeley's one of them. There's a bunch of different colleges that are partners, and so we were the cohort that went to Cal.
cool. And what is posse? Like for kids that might be interested, what do you have to do to qualify or to apply?
Yeah, so it's spelled POSSE. It's based on this idea that, especially people who have maybe in the first in their family to go to college or might not have that built-in support system. It's the idea that you literally are stronger with a group of people that go with you, and you go with kind of a built-in family of the 10 of us. We meet before graduating high school. We get to know each other, and then we go off to college together. The I guess easiest way is kind of you can go on their website, and not that I'm a sponsor
Yeah,
for it.
no, great. But that sounds like a great resource anyways. Yeah.
A counselor reached out to me, but I'm happy to answer questions about that and send information and be a plug for that too.
Yeah, so actually, if anyone, I know actually this was really exciting. A lot of kids sent in questions ahead of time, and we'll try to answer those along the way. If you have any questions as Theo is talking, please share them in the comments, and we will answer those as well when we have a chance. So was UC Berkeley something that Posse suggested to you, or you knew you wanted to go to UC Berkeley in particular, or how did you fall upon that?
Yeah, so I knew of the college, of course, but it wasn't necessarily something I was actually planning to stay closer to home. I was even considering like the 2-year community college route and then maybe applying to college from there. So yeah, I would say that it was on my radar, but it wasn't necessarily something I was going to. I don't know if I would apply to it on my own. I was mostly applying to like state schools, and I did apply to like other like UCs that were kind of closer to home for me.
And then when you found out you got in there, then that was like your top choice.
Yeah, but yeah, I couldn't say no. So
yeah, that makes sense. But I guess a good lesson here is to like reach out, especially like it sounds like you had like a good mentor in our SRLA coach at John Burroughs, and then maybe that gave you the idea, or your family or whoever, to reach out to counselors in your high school. And kind of to look for those mentors to help you find, whether it's through Students Run LA or some other organization, some connection on how to get to college or where to go or what your options are.
Mm-hmm. Yeah, and I know that, I mean, for me, sometimes that was difficult to navigate. Like having a mentor sounds cool, but actually, how do I find one, or how do I reach out to people? And yeah, sometimes it's maybe talking to a teacher or talking to a counselor, just expressing interest or asking those questions. And that's kind of what happened. I mean, from my experience with someone sort of led me to this counselor who then recommended. Yeah,
and I guess trying out different things, because like you might try to talk to one teacher and it's not a great fit, then you try to talk to another teacher and it's a better fit. I think that's great advice. And then, so you went to UC Berkeley, and when you went to UC Berkeley, did you already know that you wanted to become a doctor, or how did that play out?
Yeah. So like I said, I was given the opportunity to go to Berkeley with the help of this scholarship. And my idea was community college, because I actually didn't know what I wanted to do. So I actually spent the first 2 years of Berkeley kind of taking random classes and trying to figure it out, to be honest. I was a psych major, so I graduated with a degree in psychology.
Cool.
My idea that I wanted to do therapy or things like that. Without being too long-winded, my 3rd year of college, I got to do a study abroad program where I got to go abroad. I lived in Ghana, West Africa, for about 9 months, and sort of fell into like volunteering at different, like, at first it was like an orphanage, and that turned into like more healthcare related things. So just kind of volunteering, and ended up working in the healthcare environment. And I realized that on top of some of my personal family related health issues, that, maybe medicine or something was something I wanted to pursue. But coming back to Berkeley, I was now a senior in college, and I can talk about this process later, but in order to apply to med school, you have to take a certain amount of science classes, which I didn't have because I was a psych major. And so there's a program called a post-bacc program, so a post-baccalaureate program, where you can take the science classes needed to apply to medical school. Mm-hmm. So I lived in Oakland for those 2/3 years, did a post-bacc program up there, where I was like kind of working and taking classes.
So this was after you already graduated from
Correct.
Berkeley.
Yeah, so I took
So I really like this. So like you graduated and you didn't quite have, I just think like I know someone else who's in med school who has had a similar story, but the idea that you don't have to know on day one that you want to be a doctor.
Absolutely. I was 21 that I wanted to be a doctor. So yeah.
Okay, so after you graduated with a psych degree, which probably is still nice since it's healthcare related.
Yeah.
And then you did this post-bacc to get the credits you needed to go into med school.
Yep. Mm-hmm.
Cool.
And from there, I applied pretty broadly to medical schools. I just shot a wide web from California to Florida and everywhere in between. And
nice.
I interviewed at a few places, and I actually, it sounds random, but I fell in love with the University of Cincinnati, which is in Ohio and a long way from home and anything I was used to. So yeah, I spent prior to this year, I spent the last 4 years in Cincinnati, Ohio for 4 years of medical. And then after medical school, that's when you apply to residency. So I'm currently doing family medicine, so primary care. And I was lucky, at least for me, fortunately, to match at UC San Diego. So that's where I've been there for a year and 2 months now. So
at what point in med school do you have to, because now that you are doing residency in family medicine, does that mean that like that is the kind of doctor you will become?
Yeah, so great question. I also see a question in the chat that I'm happy to answer. But yeah, so in medical school, I guess it's kind of analogous to college where like you don't have, the first 2 years is everyone's kind of learning the same thing. You're just kind of, getting all the foundations and fundamentals. And then usually third year is when you do actual rotations in all the big specialties. So you do surgery, you do pediatrics, you do family medicine, you do all the different specialties. So you get a flavor kind of 1 month at a time. And that's kind of when people start to determine. I would say a lot of people know because they maybe have doctors in their families or they're just very interested in surgery. So they know going in. But for me and a lot of people, I would say a lot of people don't know until that third year because it's at the beginning of your fourth year when you start to apply for the specific residency program.
And that's your last year of med school. So it is very similar to the college system where you have a few years to figure it out.
Yeah, absolutely. Mm-hmm.
Okay.
Yeah.
And then, so what drew you, well, maybe let's take a break just because we're moving forward. The one question that we had in the chat was, could you talk a bit more about your post-bacc program, please? That he's a non-trade pre-med student that just graduated from UC Davis and has no idea where to start with regards to post-baccs.
Perfect, because that's right where I was. So literally, I remember Googling, like, because I knew I wanted to stay in California. So I literally Googled California post-bacc. There's like I can look in a little bit, but there's definitely a website that kind of lists all the programs that are accredited. And by accredited, I mean it's guaranteed that if you take those classes, they will, be approved to apply to medical school. And so that's kind of what I did. I think I applied to most of, I think UC Davis has one. But there was definitely like Scripps down in this area. There was, I did Mills, which is in Oakland. And then I think UC Berkeley has like an extension program which counts. And so that's kind of how I did. I also, like you, or I'm sorry, I didn't see who asked the question, but I also didn't really have guidance. It was kind of just, I had heard about it. I had the research, like I had heard from other people at Berkeley that they had done post-baccs. And so with that knowledge, I kind of just Googled how to apply, and it's pretty straightforward process, but yeah.
And then is it also possible, instead of a post-bacc, can you take the classes through like a community college? Like, can you fill in your education that way? Yeah,
there's a lot of like, I guess you could say a la carte ways to like.
Okay.
I know I need general chemistry, and I can take that at SMC, and then I also need biochemistry. Maybe I take an online UCSF course. So there's lots of ways you can like. I went to a program where it was like kind of more structured, which for me was
okay.
Nice.
Got it. Yeah.
So I guess I should have started with that. Was yes, you can take classes as you need them, but there's also formal post-baccs where you are kind of, it's more regimented, I guess you could say.
Got it. They like give you exactly what you need, and then you know that when you've completed that, then you're good to go.
Exactly. So.
And then how does is that something that like you can get scholarships for, or you needed to pay for it or get loans?
So that for me personally, I had to I applied to a couple of scholarships. They're pretty small because unfortunately post-bacc programs are considered certificate programs. It's not like a degree that you're getting.
Mm-hmm.
That was something where, you know, I had to, well, the way I chalked it up was it was essentially like my 5th year of med school, because with med school, you're probably going to take out loans.
Yes.
That's kind of how I thought about it. It was an investment into that. So yeah.
Of course, of course.
Mm-hmm.
Okay. So I guess if money is an issue, but you're right that like when you go to med school, it sounds like you basically have to you will have to take loans.
Mm-hmm.
But if money is an issue, you could go the more a la carte, as you said it, way through community college, but maybe it's harder than to know that you've done everything you need to get in.
Yeah. And even
so
with medical, talk about that separately, or I'm happy to answer questions after the call too. But yeah, with medical school, there's ways to apply for scholarships and get some money towards medical school as well.
Yeah. Yeah. It sounds like a big undertaking.
Yeah.
Okay. So, I guess if you have more questions about the post-bacc, please write, and Theo seems happy to answer everything. So when you were in med school, what drew you to family medicine out of everything?
Yeah, no, I think it was sort of a combination of like 3rd year when you do every rotation. I liked a little bit of everything. So I got to do OB, which is when you get to take care of patients who are pregnant and deliver babies and do women's health. So I like that aspect. I like doing sports medicine. I like doing like just hospital medicine. And so because I couldn't like pin down, I think it's kind of true of most family medicine doctors that they like having like a variety because you never know what's going to work. And yeah, I think I liked the idea of having continuity with my patients. So being able to like, you know, I can see you now and I can see you again in three months and I can see you again after that and like actually build that relationship. Whereas sometimes with surgical specialties, you do one procedure and then you may never see that person again, which is fine. Some people love that, but for me is more wanting to have that kind of ongoing relationship with my patients.
Okay, so family doctor, you will be like the primary, is that like the same as a primary care physician?
Yeah.
Okay,
so,
cool.
Like, yeah, in a clinic or outside the hospital, hopefully outside the hospital.
Yeah, that's awesome. So, do you have, how much do you have now? So what are you doing now in residency? I'm curious about that.
Yeah, so basically it's kind of similar to med school where every month we do different rotations just because you need to be well versed in a bunch of different things. So like this month I'm on a palliative care elective. Palliative care is kind of when you're taking care of people who maybe have end stage illnesses or need pain management or things like that. So just kind of navigating and taking care of those patients. Next month I'm doing like a cardiac elective, which is basically like a heart elective where you are working with cardiologists. And so it's like every month is kind of a little bit different just to get like the different tools you need.
So right now it's not like everything you're doing is family medicine. You're getting versed in a lot of different things.
Yeah, and then I also have like at least once a week I have a clinic day where I'm in my like continuity clinic where I'm seeing like my patients.
Okay, and that's more geared. And so like if you had a different specialty, you might be doing something else with those clinical hours.
Right, exactly.
Okay. I guess that leads us to another question, which is, where did you get clinical hours?
Yeah, great.
She says she's tried to apply everywhere and anywhere, but you can't seem to find a single place that'll take me in. So is that very difficult to find?
Yeah, it's like that age-old question when you apply to a job and they say you need more experience, but you're asking to get the experience.
Right. Okay.
Yeah, for me, it was actually Children's Hospital of Oakland.
Okay.
Back up there. So it was just kind of reaching out to their volunteer services, which now it's like online where you kind of that's what I did was I reached out to the Children's Hospital, just did the application. They're usually always, I don't know in the age of COVID, how that might be different, but at least then they were always kind of like happy to have you come in and that experience led to other volunteer experiences where I was able to get like enough hours.
Yeah.
That's basically how I did it.
So it sounds like maybe she just needs to keep applying. And
Yeah,
then once you get one, that it gets a lot easier after the first
yeah.
one.
But I would apply to, I mean, depending on where you are, I would apply to like the, you know, CHLA, UCLA, USC, County Hospital, like all the, just even the Veterans Hospital, they're always like, or I don't know in the age of COVID, but they used to be very,
Probably they
yeah,
still need more help. I don't know. That would be my guess.
yeah.
You can speak to that. Not that's not exactly advice, but how has it been to be a resident during the age of COVID?
Yeah, so I guess I could say I don't know what to compare it to because
Okay.
I started residency in June of 2020, so it was like, yeah, COVID was actively new, and then I was actually on multiple inpatient, meaning like in the hospital rotations during like December and January of last year, or I guess this year when there was another spike. But yeah, I feel like when the world kind of stopped outside the hospital, it was weird because like we were actively
Yeah, super busy.
yeah. And so yeah, I think it'll always be a rewarding and just like it was definitely a trying time. You had to like learn how to make do with sometimes limited resources and limited personnel because hospitals were also like often UCSD was like maxed out capacity, as were other
Wow.
hospitals. All that to say, I think it definitely made for good learning and good experiences, and yeah, I don't know if that answered your question.
Yeah. So that kind of suggests to me for this person that's trying to volunteer that there's probably lots of hospitals that need as much help as they can get.
Yeah, I mean,
which is bad, but
so I assume
yeah.
But yeah.
Another question: did you have any research under your belt prior to applying? And how important is research? Like, I guess both prior to applying to med school, but then also in med school, was that a big part of your course load?
Applying to medical school, actually, yeah. So the only research I really had was actually kind of related to my psychology degree at Berkeley. We had to do some like psych related, just for a graduation requirement. So I was able to kind of talk about that research, even if because some people think, oh, I need to have like super strict medicine research or like, in a lab or something. But I was able to just talk about, my psychology research and, as long as you can talk about it and own it, I think that's what they care about.
Is that in your, that's like in your, because to go to med school, you have to do interviews, right?
Yes, exactly. So they ask you that. It's part of your application. I mean, I think a lot of med schools nowadays are moving towards a more holistic approach. And even the interview process themselves are very, much more conversational, and they kind of put you in different situations. So it's more not just like, oh, let me read off your CV and tell me about this. It's more like, oh, like if someone walks in or like, tell me about a life experience where this happened. So it's a lot more like trying to get to see who you are as a person than like just check a box. But there are boxes that have to be checked, like clinical hours, and things like that. So.
And I guess the Mcat, right?
Yes, and the Mcat. Yes.
Yeah. So, do you want to say anything about the Mcat? I mean, you were laughing.
No,
I don't know. I'm guessing it's not a favorite part of your journey.
Yeah, I would say standardized tests are forever a part of, I guess, becoming a doctor and staying a doctor. But yeah, it was kind of just that was another part that was nice about the regimented, like the structured post-bacc that I did, was that they also had like a built-in Mcat Prep course.
Oh, wow. Okay.
Yeah.
So that is a bonus.
That was a bonus, but the same resources can be like obtained even when you're doing it by yourself. But there's very good, like, I think that the Princeton Review and like exam crackers do a great job of like making sure that you'll do fine if you kind of follow their outline of like scheduling, studying time and stuff.
Okay. Yeah. So I guess like the boxes that you check are important for getting into med school. But then also I'm imagining the fact that you had some life experience and you didn't go the necessarily most common route of like, I know I want to be a med student from day one. That can also kind of at the end of the day boost your interview process because you want to be there and you know what you want and all these things.
Yeah. I think, there was a lot of I would say like 60% of my incoming class when I was a med student, like went straight through. And by straight through, I mean, they went from college directly to med school, which kudos to them. There's
Yeah.
a route for that. And then I would say a number of us kind of took a different route, which is fine. And I think that, yeah, I was able to explain and describe some of my like quote unquote life experiences that, you know, maybe also help shape who I am and what type of doctor I want to be. So.
Cool.
Yeah.
So how much do you have left in residency now?
So family medicine is 3 years of like residency. So I just started my second year. So the academic year is like July. So I'm 2 months into my second year.
Okay.
And then, yeah, so it'll be June of 2023 when I'm technically done with residency.
And then what does that look like? What comes after that for you?
Yeah, so you can choose if you want to do like a specialty, because there's always more learning to be had, I guess. You can do like a fellowship, they call it. Those can range in length. And then, or you can just go into practice. So that could be just being your own independent doctor, whether it's working at a clinic or as part of like a hospital group. So, yeah.
And what do you see yourself as doing after? What are your goals with this?
Yeah, so I definitely want to do, I guess, tying it all the way back to even SRLA and just like the people that have come into my life and posse. And I want my patient population, I envision myself being in either, you know, LA, Oakland, San Diego, like an inner city. I want to do urban, underserved, like healthcare.
That's awesome.
And then within that, I want to maybe incorporate global health. So maybe being able to do like trips to, I mean, now I'm close to Mexico, super close because I'm here in San Diego, doing trips to different places and trying to incorporate medicine and yeah.
Have you had a chance to do anything like that with something across the border or not?
Unfortunately, in my time, a lot of that has been kind of like on hold because of COVID, but I'm hoping things open up. We do.
Is that something? Yeah.
Yeah.
Is that something that San Diego is like? There are opportunities for that in San Diego.
Like we have a connection with a lot of there's a lot of like border health stuff that we do. It's just we unfortunately haven't had as much time to or opportunity to do it because of the restrictions.
Yeah. I guess like you touched upon it a little bit, SRLA, LAUSD. I think a lot of the students coming through Students Run LA and the LAUSD system are minorities or, like you said, from underserved communities. And how is that represented in med school? Is it hard to be a minority in med school? Did that prove any challenges? Because I think statistically it's a minority, right?
Yeah, that's definitely a big question, and something that I am and currently deal with. I think one of the reasons why I chose Cincinnati for medical school was because of how just dedicated they were to kind of underrepresented students in medicine. And the dean of diversity and inclusion and equity there, Dr. Mallory, was kind of like became like my mom away from home when I was there. And so I think it was to make sure that they were trying to represent the patients that we were going to be serving with people that looked like them and came from backgrounds like them. I'm also part of here at UC San Diego. I'm working with like medical students and our residency programs to try to, you know, continue those efforts to make sure that, so.
And so do you have like, so that's something you're saying, like when you chose what med school to go to, is that something that, like some med schools are more focused on inclusion than others, and it's something you can search out?
Yes, I would say, you know, sometimes it's hard to tell from a website, like, because a lot of places do tout, you know, different things, but definitely when you interview and ask questions of residents and faculty and things, you can get a sense. But yeah, being a, you know, I guess sort of representing, you know, in medical school, when you're kind of a small fish in a big pond, it can be overwhelming. And so that's why I think having that support system and other students around me that were also from similar backgrounds was
right.
Me. And that's why I think I picked that medical school over other ones, if that makes sense.
Cool. And are there other ones that are like very focused on, or like very open? I don't know if focused is the right word. More welcoming.
Yeah, I think definitely the UC system, like all that's, you know, they're I think they make it a point to, UCSF. I know UCSF is like a very well-known school, but I was looking at their OB-GYN incoming class, and it was like 7 out of 8 were from, you know, underrepresented minority backgrounds, and so I think
That's
there's definitely
awesome.
you said, yeah.
Yeah, so I guess that's something to look into when you're deciding where to go, is just you want to feel welcomed and appreciated wherever you go.
Yeah, I think, when you're making the medical, even college, there are college lists of where you want to go, but also medical school, it's like, some people, I had my whole like spreadsheet of like, yeah, like the education, obviously, the training, weather, the city, but for
Yeah, of
me, ever
course.
like inclusion was up there personally, in
Yeah,
terms of,
yeah.
or when I went to a place, whether it was like talking to the students or like just observing and seeing like what the population looked like.
Yeah, and I think that I don't know about your experience, but for me, definitely coming from LAUSD in particular, some places that I went to visit when I was considering where to go to college, it was a bit of a culture shock that the diversity was lacking. So I think you make a really good point of it's something that growing up, maybe depending where you grow up in LA, but going through the LAUSD system, you might expect to see a lot of diversity.
Right.
And don't take that for granted when you're trying to pick your schools, because you might have like a big culture shock
Right.
if you don't think about it.
Correct. Cincinnati was definitely in and of itself a culture shock, but for my time there, I really did enjoy it. So
Yeah.
yeah.
Okay. So we're running over time. There's been a lot of questions and a lot of insight. I think let's see if there's any last questions to answer from previously. I guess we can finish on this one. What has so far been the most challenging part of residency?
Ooh, that's a good question. I mean, it'd be an easy answer to say COVID, but I think just learning how to, be in. So the first year of residency is like you're called an intern, and you just have a lot of responsibility. It's a lot of hours, and so I would say people can warn you that it's hard and it's difficult and that it's long hours, but it was just actually going through it. And there's weeks where you work 80-hour weeks and you're in the hospital.
Yeah, crazy.
When it's dark and you leave when it's dark, but I think trying to carve out time as best you can to like hold on to the things that made you want to go into medicine, and not losing sight of that, because that helps to keep that flame going even in those dark moments.
Yeah, for sure. And that's good. I think that's great advice, like for any career you choose.
Yeah. Yeah.
Especially if it's an intense career, there'll be hard moments, and just like remembering why you're doing it and that you want to do it. Yeah,
Right.
that's really good advice.
Yeah, absolutely. But yeah, I'm happy to, it's probably easiest if I give out my email. Happy to like field other questions, and give out like resources to different things that I mentioned that helped me get to where I am.
Yeah, so if anyone has questions, maybe just send it to the Instagram of Students Run LA, and we'll get you in touch with Theo. Thank you so much for, oh, look at this. Can you see the comment too?
Thank you, Melissa. I appreciate it.
And also for anyone watching after the fact, if you have any questions for Theo, please send them our way, and we will get them to Theo. But yeah, Theo, thank you so much for sharing your time.
No, thank you.
And good luck with residency. And like, it sounds like you're going to do amazing things afterwards. So good luck with it all.
Thank you. Thank you so much. And yeah, I really appreciate the time.
Have a good evening.
Thank you too. Talk to you soon.
Bye.
Thanks, everyone. Bye.